Healthcare was one of the focuses this year at the 2017 National ADA Symposium in Chicago.
I think it's exciting that this year at the ADA Symposium there's a whole healthcare track, which shows me that there is more interest in this, that we have health systems across the country that are trying to do the right thing.
Yomi Rong is the Regional ADA Program Manager for Sutter Health, based in California. She also presented to symposium attendees about best practices when it comes to inclusivity in healthcare settings.
We're here really just to share best practices. We've been working the program for a long time and learning as we go, and we're pretty proud of the progress that we've made. I think that we are definitely a leader in the industry in terms of providing equal access to quality care for patients and visitors. I presented 2 workshops on Monday, one which was a basic overview of how to structure and organize a disability compliance program in a healthcare setting, so for Title II and Title III entities. And then we follow that up with an advanced session where we talk about strategies for implementation.
While Sutter Health shared its work, the Northeast ADA Center is invested in assisting healthcare organizations in its region, which includes New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, to develop similar guidelines so that both people with and without disabilities are afforded the same level and access to healthcare.
What we are doing is we are seeking to do research on disability-related barriers, challenges, and issues. We are partnering with organizations to conduct that research, and we are offering in exchange intensive technical support and training to meet whatever challenges those organizations are having. We really are looking to improve implementation of the ADA.
Back at Sutter Health, Yomi tells some areas her organization has concentrated on.
When we talk about best practices, it's about, what happens at the point of care. Can people get to the doctor? Can people get through the door? That's the physical access part. Are the buildings and sites that we're building or that we're maintaining, are they accessible? And so we went through surveying processes and then construction programs to make sure that all of our hospitals and clinics are accessible and that we're meeting the standard or exceeding it in some cases. And then best practices in just the delivery of healthcare. So making sure that we have appropriate medical equipment so that people with disabilities can get a physical exam, for instance, can be weighed when they go to the doctor, can get onto exam tables that are height adjustable, that people with disabilities, people that maybe their first language is ASL, that they have interpreting services or other auxiliary aids and services available to them, that we're providing communication access, that we're providing documents in alternative format to patients and visitors who might need that. I mean, everything that you can think of in the universe of disability.
To connect with the Northeast ADA Center, log on to northeastada.org.